This is Christopher Blankenship, and this is my health promotion project for oral cancer. Um, for my first slide, I have the question, what is oral cancer? Um, the strict definition of oral cancer simply means cancer of the oral cavity, and this includes the tongue, lips, anything in that oral cavity, hard palate, teeth as well. And the etiology is comprised of carcinogens such as tobacco and alcohol, as well as biological factors like HPV, syphilis, chronic candidiasis, as well as other viruses. So, biological and non biological factors, but tobacco and alcohol are very, very big ones, as well as HPV. Um, if I had to describe the pathophysiology, it is oral carcinogenesis forms, which eventually evolves into an invasive phenotype leading to cancer of the mouth. My next question is, what are some clinical manifestations? So, what are we going to see in someone that has oral cancer? And there's a long list. It really just depends on the type of cancer in the mouth. Clinical manifestations can include lip or a mouth sore that does not heal, and I'm not talking about like a canker sore or anything like that. It's just it could look like that and be mistaken, but it just does not go away. A white or reddish patch on the inside of the mouth, um, loose teeth, a growth or a lump or like a mass in the oral cavity that doesn't go away. Oftentimes there's no pain involved in them, um, but there can be. Mouth pain is another big clinical manifestation. Ear pain, so that mouth pain can radiate towards the back of the ear. Um, Difficulty or painful swallowing, so it's dysphagia. We'll get further into that in a few. So next I have, how is oral cancer diagnosed and tested? Which it's really dependent on the type of cancer itself. Um, but some big forms to diagnose and test for oral cancer include physical examination. So a provider will inspect the oral cavity for any surface level discrepancies, such as I mentioned, the mouth sores or red or white patches. They can also use a biopsy to test for cancer cells. So if there's a mass or even that those patches or anything like that, they can take a piece of it to further look and test of it. CT or MRI scans. This one's a little more extensive because it shows more than just the mouth, but it can also be used to diagnose oral cancer. An endoscopy as well can be used for further detail, similar to the MRI or the CT. It's more extensive. For my next question, I have, what are some common complications of oral cancer? And like manifestations, there are a lot. Written, I have primary complications of oral cancer include things such as oral mucositis, or simply this is an inflamed mucous membranes in the mouth. So there's a lot of inflammation, could be causing a lot of the pain. Further evolving, I have infection, systemic infection, as well as salivary gland dysfunction. So if there's a mass or a lump or something, it can block the salivary gland, making it hard for it to produce saliva, drying out the mouth and the mucous membranes, ultimately making everything worse. Changes in taste and pain, mouth pain, is like I said before. Due to these complications, Dehydration and malnutrition are fairly common and should be closely monitored. As I said before, they could have trouble swallowing or things such of that nature. So it's going to be hard for them to want to eat or drink, and it can lead to even more complications. For my next question, I have, how is oral cancer treated? There are a variety of different ways. It really just depends on the type of oral cancer. You could have a lump compared to something like a skin cancer in the mouth or the lips. So it's really just dependent on the type. But I have a list here. Oral cancer is treated in a variety of ways depending on the form of cancer. Many common treatments include things such as surgery. So if it's a mass or lump, they can take it out if that's a viable option. Radiation and chemotherapy, which are typical cancer treatments. Targeted drug therapy, and immunotherapy. With these as well, it can cause a lot of fatigue, especially radiation and chemotherapy. They're probably not going to really want to eat, so you got to watch that on top of all the complications and manifestations. What are some nursing interventions and patient education? So for nursing interventions, it's important to promote comfort. So patients with oral cancer, especially if it's further down the prognosis, it's going to be very painful and it's going to be hard to deal with, and they're not going to want to do a whole lot. So making sure you stay on top of pain, nutrition, just overall comfort measures, it's going to be really important. Patient and family education, educating your patient on anything related to their cancer, their treatment options, what the best route looks like, managing treatment side effects. As I mentioned before, with chemotherapy and radiation therapy, there's a lot of side effects. So managing those is going to be really important because you don't want it to cause even more pain than it already has. Monitoring and adherence to therapy, making sure they're staying on top of their treatments, aiming for best possible outcome, and promoting safe prescription practices. That one's really important because it goes along with the last one, monitoring adherence to therapy, cross-checking their medications to make sure there's no interactions, things of that nature. As far as education goes, it's important to stress the avoidance of tobacco and alcohol because these are two of the leading causes of oral cancer. Some other topics to include are HPV vaccines, which is another leading cause, sun exposure, because as I mentioned, the lips count is part of oral cancer, so it's important to minimize sun exposure on the lips. Diet. A diet that's low in vegetables and fruits is very commonly linked to oral cancer, and it also regular dentist visits. So you're going to the dentist and you feel fine, and then they point out that there are signs of oral cancer. It's a big thing, and one of the best ways to prevent oral cancer. Lastly, I have my NLN competency. So the National League of Nursing states that nurses should use best current evidence coupled with clinical expertise and patient preferences and values to make practice decisions. This quote can be related to the topic of oral cancer by using the best current evidence. So everything you know about this client, what they've been treated with, how they've been treated, what they want to be treated with, using the current evidence to provide appropriate care depending on the patient's prognosis, progression, lifestyle, and values. So is there any cultural reason that they would go a different route for treatment? Things of that nature. Really important. And on my very, very last slide, I have my references. I use things such as the Mayo Clinic National Cancer Institute, National Institute of Health, which is a government website, professional papers, as well as I use the NLN website to get my competency. So that is everything related to oral cancer.